Hello, I'm Sarah and I am a professional psychologist with Therapy Pro. I work with clients of all different ages. So my youngest client at the moment is 9 and my eldest is 60. I guess challenges and experiences, so like anxiety, depression, trauma, like post-traumatic stress disorder, like just intrusive thoughts, feelings of like dysregulation and just wanting to understand better how to sort of regulate your emotions and feelings. And I guess particularly at this point in time with a lot of uncertainty that's happening and a lot of change that's happening, and just sort of helping clients to understand how to move with that, how to roll with that, how to know that they have what they need and they can learn more skills. Well, prior to the Zoom session, we usually send out a little bit of info and that will be adapted depending on the age of the client. You can also connect on your phone, and that's just a matter of downloading the app, which can be quite an easy process. But if there's challenges with that, we can also chat about that on the phone as you're doing it. Most of the time we set it up on our end so that once you click on join the meeting, the video is already turned on, the sound usually works already straight away. There might be something that you need to adapt on your end, or you might be on mute. It comes up in your actual video in the corner and it looks like a little microphone, and if you're on mute it will have a cross over the little microphone. So that a pretty cool thing and a pretty fun thing about doing sessions via telehealth is that we can actually interact. It's called remote control, and all I need to do is click on something. It actually allows you to move the mouse around and do stuff on your end, but you can also request that. So if you're thinking, I really want to, be able to write something in here, or it'll ask me and I'll say yes, and then you can do something like that on your end. Share my screen now. Noticing your feelings or looking at your feelings can sometimes be actually pretty darn scary, uncomfortable. Sometimes it's more helpful if you can just separate it out from yourself a little bit. And so using this chart, you might go, actually, this sort of looks a little bit happy, and just recognizing that, but it sort of feels a little easier to do it, especially with younger people as well who have a pet and they feel comfy with their pet. This kind of thing is something that you'd probably use for particularly the layout of this, someone who's a little bit older. In this situation in telehealth, I guess make a little success story together, put some things that are helpful and relevant for the client. In this particular situation, she's wanting to reduce her cigarette smoking. So at the bottom here, we're looking at pros and cons of doing that, and something that we can do together in the moment during the session. I can email to her straight away as soon as we're finished, and then she's got a record of that and can look at it during the week, or she can think about things she'd like to add, or we can talk about next time. There's actually one that you can move things around. So at the moment I'm moving that one around, but if I actually go and I give you remote control, so if you want to move one of those, now you can move one of those across. Actually, a lot of my work with adults and children in the kind of work that we do is actually getting to become just more aware of how we're feeling at the time, at different situations, and knowing that that's okay to feel that, and actually take the time to stop and notice that and get better at communicating that. Because a lot of the times when you feel like you don't know how to tell someone or communicate it or talk about it, that's when you sort of start feeling more anxiety, more closed in, more depressed. If you're someone who gets a little bit nervous in social situations, or going outside of the house, or things like that, this is perfect, because it means that you've got that little bit of distance, but we can still see each other, and we still get to chat and talk the same way. And you can be comfortable, wear your comfy pants if you want to do that. So I'm actually finding it enjoyable and exciting, and I like the opportunity of being creative as well and making things that are very suitable for each person. Just give it a go, because there's no pressure. You don't have to, if you start it and you have a go, think, no, I just really don't like this, it's not feeling right to me, that's fine. Maybe 2 sessions, and then you start to get in your rhythm, your feel. You're like, oh yes, I'm looking forward to seeing this person's face, and we can chat about even how you're feeling about telehealth as well.